Yesterday, we talked about the risk of measles as millions of fans travel to and from Massachusetts for the FIFA World Cup. That's just one risk. Joining us now is Dr. Simone Wildes, because it's Friday, and that's when you join us with your wonderful smile, an infectious disease physician with South Shore Health. Good to see you, doctor.
Yes, thank you for joining us. What are the other infectious diseases, doctor, that health experts are most concerned about during an event like the World Cup?
Well, Jennifer, this is a wonderful time for everyone to get together and celebrate with this soccer event. I will say that brings with it a lot of increased risk for infectious diseases such as respiratory illnesses like the flu and COVID. We also have to worry about GI illnesses and foodborne illnesses like traveler's diarrhea that can be common, norovirus. We also have to worry about sexually transmitted infections. When we have mass gathering like this, there's alcohol consumption and there's a lot of sexual activity, which increases the risk of sexually transmitted infections.
All right, so for the average traveler, what's more likely? Something like a rare disease or things like flu or COVID or, like you said, the foodborne infections or norovirus?
Well, that's a great question, Maria. But I will say common things are commonly seen. So what we expect is that we're going to see more of the things we're accustomed to, like flu, COVID, and RSV. Now, you have known or seen in the past that we normally get surges of COVID during the summer months, which has been happening since 2019. And another point that people tend to forget is that in the summer, we don't have flu in the US, but in other parts of the world, like the Southern Hemisphere, they have the flu right now. So when they travel here, they are going to go ahead and bring the flu with them. Now, another thing that brings me to is we're hearing a lot in the international news about Ebola. But I will say that's not a threat to the general public in the U.S. at this time. So that's definitely something that we're not likely to see right now based on data.
All right, so just being proactive is the number one thing.
Thank you, Dr. Wildes. Appreciate you.
Okay, thank you.